It comes and goes. We're out here chasing a feeling.
Hello, everyone. Welcome to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. This is your host, Tara Martini, along with host Becky McNattin. We're so glad to have you listening as we live and share stories of mental health.
I am very excited today, Tara.
Why?
You know why? We get to do a whole show with our sponsor of Feels Out Loud.
Oh,
Macy Krishnan is here from Emerald Therapy, and it is so good to have you here. Welcome.
Thank you. Thank you for having me.
Now, Macy, you are a fan of Feels Out Loud and sponsor this radio show to help make it happen. And part of why you're a fan of Feels Out Loud is because you, just like us, are very passionate about mental health care and experiential ways of processing. This show is all about cultivating meaningful discussion around mental health, as well as highlighting how to live mental wellness every single day. So a huge thank you to you for supporting us and our mission. We, Tara and I, are also a huge fan of yours.
yes,
And
we
are thrilled today to have you on the show to spend the entire time talking about a treatment modality that you are particularly focused on at your practice. You own Emerald Therapy and are a clinician and have been on our show before, but it's been a while. Could you share a little bit about you with our listeners?
Yeah, absolutely. Thank you again for having me back. So I am a fully licensed clinical social worker practicing as a therapist now for about the last 9 years, and had a prior clinical social work career different before that. But over these last 9 years, I've been doing therapy, and then the last few years branched out, started a group practice here locally in Eden Prairie called, like you said, Emerald Therapy.
Okay. Which is growing and offering all sorts of care to people of all ages.
Yeah.
We're talking about accelerated resolution therapy today. What the three of us, as we keep talking, might call ART
Yes.
throughout the show. In this field, listeners, we love acronyms.
Yes,
We
do.
use them all the time for all the things. So you might hear us say ART, and we will spend a lot of time talking about this framework of practice. But will you tell us what you love about ART?
Everything. And I guess I have to say something specific.
Yeah.
So I will say I like that it's different. It's different than what we traditionally have thought of therapy as, and I can't wait to talk more about that, but I'll just start with it's different.
Okay.
But it can also be quick in effectiveness for people. And so selfishly as a therapist, it's fun to get results, and so it's different in that way,
Right.
where we might not be waiting years to see something shift. And so it's really unique in that way.
Well, and how great for the client as well.
Yeah, I
Mhm.
was going to say, when you mention that it's as a clinician or a provider, it's fun to get results. As a client, it's fun to get results.
Yeah.
When we can experience a modality that after a few sessions, and you and I have had conversations about this at our practice as well. We've had conversations about ART that sometimes in as short as one session.
Mhm.
It's not like you live a different life after that one session,
Right.
but you experience some sort of change. And that's a game changer.
Yep. That's exactly right. That's what I love about it, because then I think if somebody can get like a shift pretty quickly, it only furthers the buy-in of wanting to continue, maybe not even ART, but just therapy in general. Like if they can experience results quickly, it's the snowball effect of, wow, I want to keep doing this. I believe I
Right.
can feel differently.
Right. Well, and think also the power of word of mouth, right?
Mhm.
So then that person shares their experience with someone
Mhm.
else who maybe has yet to experience therapy. I mean,
Mhm.
there's so much power in that.
Yeah, you'll have to remind me, I have a celebrity example of this later. Not of it actually happening, but where I wish it would happen. So
Okay.
yeah, more to come
Well,
on that.
an interesting topic. Everybody, it's
Yes.
accelerated resolution therapy. Right now, we're going to take a short commercial break, but stay tuned as we talk through ART and what makes this such an incredible option. Thanks for listening to Feels Out Loud. We will be back in just a moment.
Express yourself. Express yourself. Express yourself.
Welcome back to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. I'm Tara Martini, along with Becky McNattin. Now let's dive right back into our discussion on accelerated resolution therapy.
I was introduced to accelerated resolution therapy many years ago when I was learning about various trauma treatment options. And ART was described to me as the cool cousin to another treatment modality called eye movement desensitization and reprocessing therapy. Kid you not, it was called the cool cousin, or EMDR. And listeners, you might remember that many months ago, we also did a show on trauma treatment strategies and talked about both EMDR and ART. And in that show, we highlighted a few different forms of treatment for trauma. And so only scratched the surface of each one. This has had you and I, Tara, wanting to dedicate whole shows to various frameworks since that time. And today our focus is on accelerated resolution therapy, which Macy happens to be quite an expert in. Macy, we have tons of questions for you. Could you tell our listeners what accelerated resolution therapy is?
Yes, absolutely. I'll start by saying the history of it. It became the cool cousin of EMDR because it was born out of EMDR. So maybe that's a weird relationship. No, I'm just kidding.
They're rooted. They're rooted in many similar concepts, and so I can see why when someone described it to me as the cool cousin, they're related, but they're different.
Absolutely. Yep. And it started as an EMDR practitioner and she'll tell you herself, the founder, Lainey, she would tell you she started to adapt EMDR in a way that felt somehow better for her and her clients. And unfortunately, she strayed so far from the protocol that it was kind of like, we have to maintain the integrity of this modality. We either need to call it something else, or we really need to go back to the protocol for EMDR. And she's like, I have to do this. I have to call this something else. And that was circa 2008. So it's a very new modality.
Yes.
Very new. I may or may not have graduated high school that year. So it's very new, just a couple years ago, right?
Really aged us.
Yeah, I did
that.
not. I also graduated high school in 2008. Thanks.
Wow.
Yeah, no, I did not.
Yeah, I was like, girl,
I 100% did not.
you are closer to me, my love.
Yes, no. But you're right, though. It is a new modality. And I actually remember when I was hearing about ART, sort of naysayers about this new thing that came up that's has impact in a couple of sessions and wondering about the evidence-based and things like that. So I love that you can the highlight, it comes from something that we've used for much longer.
Absolutely.
But this is how new modalities are created, that we maybe are utilizing something and realize a way to improve it or alter it, and then a new framework is developed. So how does it work?
Absolutely. So it's essentially a trauma therapy that uses eye movements or any bilateral stimulation being stimulating bilaterally our brain. So whether that's tapping on either side of the body, the most effective research would say is the eye movements. So that's what they try to encourage people to use. But it combines the eye movements with imagery and metaphor to help our brain process stuck experiences, traumas that might be kind of living in our body.
What would you say overall is the goal of ART?
The goal would be to be able to recall a memory or a trauma without having the physiological reaction to go along with it, without having those negative sensations. When people talk about triggers, which are everywhere to varying degrees for people with trauma, whether they know what their triggers are or not, the goal is to be able to have less of a reaction to those things. And also too, another goal, I guess, would be our brain thinks it's doing a good job when it's replaying traumas. It's almost like the tape gets stuck.
Yep.
And so the goal is to be able to kind of tape it up and feed it through one more time so that we can move forward, not move on because it still happened, but move forward and function.
And the idea then would be, when you're talking about bilateral stimulation, activating both sides of the brain, that helps with that goal
Yes.
because of the way that trauma gets stored in the brain.
Absolutely, because it's mimicking REM sleep. And it's cool because I
Okay.
don't even always give clients that explanation about REM sleep. Sometimes we just go into it. Sometimes people are like, I don't care the science behind it. I just want to do it.
Okay.
And sometimes people will say, oh my gosh, this is like, it's like lucid dreaming. And it's like, yeah, it really is. You're totally lucid. But by it, you're kind of opening up what they call the memory reconsolidation window. And so you're thinking about things or recalling things, not in a weird repressed way, but things that might not normally come to us as easily. Like when you think about the dreams we have, it's
Mhm.
like, what? Why did I think about that?
Yeah.
And it's like your brain's just doing whatever it needs to do to kind of put things away for the night.
Mm-hmm. And I love that you say that our brains really think it's doing a helpful thing.
Mhm.
That can be really hard to frame it that way because it doesn't feel helpful at all, the experience of replaying. But I love that you can highlight that because our brains do think that they're doing a good job with replaying, with continuing to replay, and that this can be really a helpful modality to like fix that, change that.
Yeah.
What would you say sets ART apart from other types of trauma treatment?
So the favorite among a lot of people is that you really don't have to share all of the details of it. It's not that I don't want to know. I'm
Mhm.
happy to hear, but it's not a prerequisite to healing. And people just love that, especially the veteran population who they might not want to talk about
Yeah.
details, or maybe they didn't grow up in a time that it was okay to share anything vulnerable.
Right.
So it's, and I don't want to generalize men versus women by any means. I've seen it across the board of all walks of life of people are like, sweet, I don't have to talk about things that may or may not bring up shame, even if I don't want it to bring up shame. It just kind of lets them off the hook of like, what if I might know the topic or like the general idea, but I only need to know as much as they want to share. And that's just so different.
Well,
Super different.
and I think it is so profound in that if they believe they have to talk about it, which is something that is so tragic or traumatizing for them, obviously, then that wall is up and you have to work on letting that wall down.
Mhm.
But if they go into it, the buy-in is so much greater, right, for a positive outcome
Yeah.
in that I don't have to talk about this. I can just work and process this inward. It's the same with the modality I'm trained in, where the minute I say that, people are so shocked because talk therapy is talking about your
Mhm.
things.
Yes.
Yeah.
They're not used to, wait a minute, I don't have to talk about this thing that is so deep within me. No, you just get to process it,
Yep.
right?
Yep.
Without speaking. And you're still going to have this beautiful outcome.
Yep.
That's a great thing about this type of modality.
Mm-hmm. Yeah, because what we're saying, listeners, is this is all visualization.
It is.
So the option of expressing it verbally, you are expressing through your body,
Mhm.
but you do not have to necessarily say words out loud. So
Right.
Macy, you might not be knowing what's
Right.
going on in the mind of the person who you're
Exactly.
sitting with.
Yep.
And that's okay.
Well, and there's times too where even somebody might between sets of eye movements might start to share.
Mhm.
And it's not that I don't want to know, but I'll say, let's notice that. Let's just feel whatever you're feeling. And just
Yeah.
because it keeps you in it, it keeps you in the process versus going back up to where whatever
Mhm.
your mind is doing, if that makes
Yep.
sense. Yeah, it's really different. And I think what people notice is that coping skills don't go out the window. We need those no matter
Mhm.
what in just to even live life at
Yes.
this
To
point.
function every day.
Yes. But people do find that when they experience shifts, if and when they experience the shifts that they're looking for with ART, they find that it's then easier to implement the coping skills that they might already have. And that's cool to see too.
That makes so much sense to me. You have said that ART uses the concept of voluntary image replacement. Can you tell us more about this and how it works?
Yeah. So let me walk you through what an art session might look like to put the context to it, if that's okay.
Yeah,
That's
for
a great
sure.
idea.
So and folks, don't try this at home. Even an ART therapist should do this, therapy with a trained ART therapist. So I'm walking you through this, but just hear it to know what it could look like if you did it. But conjuring up, a scene, we might already know what we're working on. And then following the therapist guidance for the structured protocol of like, okay, I'm going to see whatever it is in my mind that is causing me the distress, just in short little bursts. So that way we're not flooding you or overwhelming you. And then the goal after that is to use the eye movements to calm whatever sensations are coming up.
Okay.
Kind of doing that piece by piece. And once you get through that, I mean, there's more to it, of course, but once you get through that, your brain starts to get more used to the idea of like, what if I didn't have to continue to see those negative images over and over? And if I've reduced the negative sensations, what if my brain would allow me to see something more positive there? And so we're literally talking about having somebody imagine erasing images. And
Okay.
it seems so weird to talk about without being in it, but that's that voluntary image replacement. For example, I
Got
do a lot of birth trauma for ART, and it doesn't, trauma's in the eye of the beholder. It doesn't matter what the actual details are that happens. It matters what gets stored in the body as traumatic. And sometimes it's a scared look on a doctor's face that
Sure.
maybe nothing bad is going on, or maybe something is. But like, let's say mom is giving birth and she sees that, and all of a sudden her nervous system is like, uh-oh, we're not okay. That might be something that when she recalls that, she feels triggered. Again, not with her permission. Her brain thinks it's doing a good job kind of replaying it to try to fix it. In ART, we get to actually try to replace that image with something more positive. Does that make sense?
That makes
Makes
so much
perfect
sense.
Yeah.
And I could see where it doesn't make any sense as the exact same time, because
Totally.
it feels like, how do you do that?
Yeah.
But what you're referencing is, okay, there's people who get trained in this modality to do this. We don't do this alone. And it gives the body an ability to experience relief and not the same physiological response to a visualization or an image in our mind.
For sure.
That we don't have to have the same connection of, I have this image in my mind, and then this is how my body feels about that image. That we do have the ability to influence that, which is incredible.
It's huge. So when I knew you were coming, as a former English teacher, I love my self-metaphors and imagery and all those things. And ART uses those. And so tell me how you integrate the use of those as tools in ART.
Yeah, what's really cool is you make sure that a client knows what a metaphor is.
I was just going to say,
Right?
could you define a metaphor and imagery before with each client? Because I think they might be like, what are you talking about?
Absolutely. What's cool is their brain's going to do it anyway, but it's nice to give them the language. So
Yes.
a common metaphor would be like, let's say I just had them see some of the scene in their mind, and they're feeling, lots of tightness in our chest. Very common sensation that comes up during processing traumatic scenes. And it might be like, well, let's imagine a tool to move some of that, whether we want to imagine a ball or like untying a ball or showering it off. Like any of those are metaphors. And so giving them those kind of small examples, and then later their brain is just going to take those and run with it and find what's going to be helpful for them. And it could be really intricate metaphors, like you think of Wile E. Coyote, if you remember Wile E. Coyote, active, relentless pursuing of the Roadrunner to no avail. And no matter what external consequences would come to him, he wouldn't stop.
Yes.
And even if somebody would have said, Wiley, you gotta stop. This isn't going to work. it wouldn't have mattered. He would have to feel that inside of him to make that change. So a client in a session might imagine themselves as Wile E. Coyote, not even planning it, but their brain might decide, oh my goodness, I'm Wile E. Coyote in this active pursuant that just is not working for me. And then they themselves can imagine, like, what if I just don't do that anymore? What if I just stop? And it's like, it comes from within. It's different in that way. I don't know if that makes sense.
Well, you're referencing something that you've watched be extraordinarily healing for people.
Yeah.
So it does make sense to me in that I can even see on your face, our listeners can't, but I can see you recalling the times that you've watched this bring change for people. One thing that I love about ART is that we can then remember an event or occurrence or circumstance, a situation. You even talk about like an actual image. We can remember that thing, but change the impact it has on us emotionally. And you've now referenced a couple of different times this physiological response. The goal isn't to push away the memories that are distressing, but to shift them. And can you say more about what memory consolidation is in ART?
Yeah. So the belief behind ART is that every time we're recalling an image, we're essentially taking it off the shelf and we're unknowingly re-editing it every time. And so maybe we're re-editing it based on the narrative we're currently living, or the narrative, I mean, who knows? Or maybe our brain has decided to forego thinking about certain things in order to protect us, kind of all of that. And the idea around memory reconsolidation, the example that I don't even remember if they used it in my ART training because it's been so many years, but the way I think about it is we're taking that off the shelf one more time together. And let's just laminate it. Let's laminate it so that it stays what it really was per our experience. Doesn't matter what the facts are, but what it really was. But what if we don't have that urge to re-edit it anymore because it's laminated, it's done, it's a package deal. And what if when we look at it again, we can see it for exactly what that experience was, but we don't have to absorb anything. We don't have to get ink on our hand. Like it just gets to be there.
Oh, I love that.
Does that make sense? So we still remember everything.
Yes.
We're not trying to erase it.
I love the laminated about we're not adjusting. We're not, having ink on our hands.
Yeah, you're actually kind of honoring it. You're in that way, you are allowing it to be what it was.
That's huge. So the National Center for PTSD estimates about 7 to 8% of the population experiences PTSD at some point in their lives, which really means that millions of people are sadly experiencing that.
Millions.
Millions. So many people having to deal with trauma. Having options for treatment is so critical. And we've talked about this on the show. That's why so many people at the practice get trained in some type of modality that's trauma focused. How have you seen ART specifically positively impact those who are struggling with PTSD?
I think it works really well for folks who have they've talked about it. They know they can understand at a conscious level why something may have been so hard, and they can validate that, and they've been able to do that. And yet then what? I can recognize that my experience has impacted me. Now what? And so I think those now what experiences are so cool, because it's like, oh, I had the relief or like the ability to process here with me the whole time. Like it's not a gift that a therapist is giving you. It's like you have it, and because you're not going to have that therapist or maybe that same support forever, but you're okay with that now because you have that internal experience. So I've just seen it be helpful for folks who it's like, yeah, will there be anything that could really help? Does that make sense?
Yeah. Well, and what must be so interesting, I'm just sitting here thinking about this as you're talking, you as the clinician don't necessarily know what someone else is visualizing in their minds.
Right.
They may or may not be saying it out loud. It could be, but you've said that they might not be. So I would imagine that there are times where you see a physiological change that is observable in the session, but you don't know what the mentalization is. That must be an incredible experience.
Yeah. Yeah. I'm getting teary-eyed just thinking about it because, and I never promise anything, right? Because you want to, Julie Stender, one of the big trainers here in Minnesota, she'll always say, like, you don't want to over promise and under deliver. So
Of course.
So you start with that curiosity of like, oh, I wonder if this could be helpful for you. And so, people go into it then with the same curiosity of like, oh, I wonder if this could be helpful. And even, just to watch just in one session, let's say it really is like a single incident trauma that we know exactly what we're going to do that day for a scene, you can see just the body language shift throughout. And I usually know what's going on, like you said, not from a details perspective, but we're always checking our body for sensations. And there's certain parts where it's like, yep, we're going to have negative sensations right now because of what we're going through. But then there reaches a point in the script where we're looking for positive sensations. And it's unbelievable that in as little as 20 minutes, you can see that physically in someone and how they're bouncing out of the office. And even they'll be like, what is this? What did
just
you
changed?
do? Yes.
Yes.
Yeah. It's really cool.
Because when Tara asked the question about how have you seen it positively impact people who are struggling, you would notice the kind of instantaneous bodily shift.
Yep.
That you aren't necessarily even sure what's going on because you aren't aware of the mentalization or the visualization, which must be an incredibly profound experience.
It never gets old. It never gets old.
I believe
after
that.
6 years.
Is ART used to treat issues other than trauma?
What I like it the most, I mean, some ART people would say, oh, we can treat everything with it. I do think there's other really awesome gold standard treatments for things like OCD. And so I like to honor those things and recognize where that research is and historically has been. For me personally, or I guess personally, professionally, I like using it for trauma and phobias is a really cool one because most of the time you can find some sort of origin of a phobia and typically reprocessing that. Now, I will say I'm scared of heights. I don't know where that came from. I've been avoiding ART to do that myself.
I was just going to ask.
I was going to say, maybe you need to do that.
No, I'm like, I think I was just born with it, but whether it's fear of spiders or fear of flying, oh my gosh, so I found it very effective for those things. And I would say too, there's tons of different ways to apply the same thing. For example, if somebody struggles, let's say somebody struggles with just relaxing at the end of the night when it's time to sit down, they feel like they should be doing something. Maybe they can use some skills and reframe, and that's fine. But let's say they want to do something more with it. Or let's say I'm like, why not try ART? Mm-hmm. Sometimes you can find, how did those core beliefs begin? That you're only worthy if you are productive, or, is it really bigger than just, oh, I struggle to relax?
Yeah.
And sometimes it's not. So then we just visualize yourself relaxing peacefully. And that can be really helpful too. Or maybe it did come from, for example, my dad, I gotta throw one at him for a second and pretend he'll ever listen to this. But his thing was, I've never taken a sick day in 35 years.
Yeah.
Well, then I grew up with like, oh, you're sick, really?
Yes.
And it's like, I know where that came from. But what if somebody didn't know where that came from? How do we start to undo those things that might not actually be helpful? Like when COVID happened, it was like, oh, you're sick? Yeah, no, don't come in. Please don't come in.
Yes.
And I had to kind of undo that core belief of like being sick is a weakness or missing work.
It's a great example.
Yes.
Yeah.
So people really do utilize it for all sorts of things.
So many random things. Yeah.
And you bringing up the component of being able to maybe relax at the end of the night. Sometimes, and I notice this in my practice, sometimes people don't realize that life experiences have even been traumatic. They're not writing it that way in their minds. And so an experience that might be, I have trouble relaxing, is tied to something that perhaps you can also process with ART as well.
Well, that's such a good point because I know that like some of the earlier generations, the only time PTSD was talked about was in reference to certain populations, such as veterans who've seen combat.
Yeah, exactly.
So if you have somebody who that's the only like language they've ever heard around PTSD or trauma, it's going to be very easy for them to dismiss their own experiences that maybe have been different than that. And so helping them recognize like, yeah, maybe we don't even want to use the T word, but what if this was stored in your body as really unsafe? And what if we need to turn the dial down on that? The other thing I like it for, this is where my celebrity example comes in. So think of Simone Biles. Remember when she took time off because she was really struggling with, and I don't remember what the word was, not the MIPS, but it was something that like she would basically freeze and she couldn't do it. And in a sense, it was valid for all the emotional reasons, but there was also logical reasons too, because gymnastics is so dangerous, right? But oh my gosh, if I would have been able to, not me, but just anybody would have been able to do ART with her, I think about it all the time. I'm like, no amount of talk would have been like, Simone, it's okay. It's
That
okay.
makes so
And
much
it's
sense.
like, yeah, but it's something's in here. So
Yeah.
performance anxiety, grief, any of those things.
The way that our body has stored and learned to connect an image or a visualization with a physical experience or physical sensations. So you've said a couple of times that just a few sessions can have a massive reduction. You've seen it happen. Can you give us some examples or describe like how this happens in just a few sessions?
Usually, so again, I like to really preface with research would say that we will dedicate, or we might need to dedicate between 1 and 5 sessions to this trauma or this kind of topic, because we might not even know always what the trauma is, right? If it's just some symptoms that we kind of need to go back and find ourselves. So I always tell people like, let's give it a few sessions and see what happens. And I never want to say like, oh, one and done, but it is really cool when there is single incident traumas that happen so often. And it's kind of like, you give it a couple weeks after a session and kind of what looks or feels different. And it's kind of like either I'm not having as many intrusive thoughts about it, or I've been sleeping better, or gosh, I don't know if there's any stuck images around it that I really need to bring back. And so that's really cool.
Wow.
But again, I don't say on the front end, like, oh, give me one session and be done.
Right.
It's more of like, let's see.
Curiosity.
Because then, and what's really cool is, most people don't just have one thing, but sometimes it's the one thing that brings them to therapy. So what's nice is if we can get some big results on that one thing, it opens up the door to be like, wow, if this could help me feel even a little bit differently, what else could I do this on?
Yeah.
Could I do this on some of my childhood stuff or other symptoms or workplace stress? We can't change what others are doing around us. All we can change is our own response to it. So it's nice to, and you can use metaphor for that too. Do I need to make my boss smaller so in my mind, so that when they yell at me, because maybe I can't leave my job right now.
Right.
And so maybe when they yell at me, it feels less threatening because I've needed to make that metaphorical change in my mind.
That makes so much sense.
Wow. Yeah.
So you mentioned just now, ART, you might do 1 to 5 sessions. Is it used for a period of time, or do you integrate an accelerated resolution therapy session and then a few talk therapy sessions?
Yeah, it can be whatever the therapist wants to do as a whole at their practice. Like some therapists, they just have clients come to them for ART. And that's, and so sometimes they'll have a different talk therapist at a different practice or a different clinician.
Got it. Okay.
Whereas for me, I'll do whatever kind of the client is needing. Like if somebody reaches out and just says, "Hey, I've been struggling with some postpartum anxiety." I'm of course going to be like doing a full assessment
Mhm.
and noticing where certain modalities will shine.
Yeah.
Like I'm going to be incorporating dialectical behavioral therapy skills right away for at least some temporary relief. But then in the long term, after a few sessions, I'm really going to be like, gosh, I wonder if we tried ART on your birth, because I wonder if some of these anxiety symptoms aren't stemming from that. We might do one session and we might not do ART for anything else ever, or we might be like, you know what, this was really effective for you. Let's incorporate it for all the things. So my goal here today isn't to explain why it's better than another modality. It's how it can be used with all of the modalities.
Yes.
So
Right.
that they all have their place,
Well, yeah, and just developing a stronger understanding of this
Yeah.
modality. Now, I have to ask, so for example, like in a different modality, it's better to have like closer as far as, the frequency of the sessions. It's better to be closer together. For ART, is it when let's say it is going to take more than one session, do you still, it's like you're going to meet them on a weekly basis and do ART each week? Or is it, hey, we're going to meet twice this week? What does that look like as far as if you are going to be doing this?
Yeah. The good news is it can kind of be whatever the client is wanting to do or needing to do.
Okay.
For example, if somebody is coming in with a fear of flying and they're flying out to Italy next week,
Okay.
I'm probably just going to plan for two kind of quick within a couple days, and then maybe not even need the second one, but have it there just in
Okay.
case we need it.
Yep.
But what's nice about ART is that if we're following the script and the protocol, with the integrity of it, we're closing up that memory reconsolidation window really effectively at the end. So there's not as much of a risk of like overflow of symptoms. Like I'm
Okay.
going to feel worse now until I do this again.
Right.
We really don't see that.
Okay.
I can't say it could never happen.
Mhm.
It's just
Right.
not something I anecdotally see. So it's nice because it can be like, well, shoot, I've got this really big trauma, but then I can see you this week, but then I'm traveling for work for the
Mhm.
next 3 weeks. I say, let's still do it. And if we
Okay.
need to connect for additional support, but I don't know that I've had to provide between session support.
That's
So
great.
it's really
Yeah.
flexible in that way.
It's a very flexible
That's
model.
so nice.
If people wanted to find a provider or learn more about accelerated resolution therapy, where would you send them, Macy?
Oh, yes. So what's nice about this is that there's only one company in the whole world that does
wow.
all of the trainings. So it's cool because you know that every person that's trained in it.
Everybody's getting the same thing.
Yes. Yes. And I think that's so cool. But
Yes.
you literally just go to acceleratedresolutiontherapy.com and it has all the resources, find a provider, all of that stuff.
So once people have been trained in it, they get put on that website.
Yeah. So I think there's a couple different ways to kind of get your name out there with it. You can put it on your profiles as a therapist. So you can, when people are looking for therapists, they can also just Google, accelerated resolution therapy. Or they can try to go on like the actual directory. I think, I don't know if everybody who's trained goes on the directory or
Okay.
if there's a fee, you know how that goes.
Yes. You pay for participation.
Yes, but it's definitely a good starting place. Or what's nice in Minnesota, for example, is this was one of the first places to really, like Mary Anders was one of the first people to do trainings here. So it's way more well known in Minnesota than other
Wow.
places. So what's nice is now we're to the point where even if you already have a therapist who's not trained, they will absolutely know somebody who is. And so it's nice because the network is getting bigger.
That's great. Well, so listeners, the takeaway really is if you want to read more, there's one main hub to go to that on that website that I've been on is some awesome research too.
Yes.
testimonials about what it's been used, but you can actually think through what a session looks like, how to prepare for it. You can find a provider in your area. So please do that. So much to think about here. We're going to head to a commercial break, but when we come back, we're going to talk through listener questions. Feels Out Loud will process your thoughts in just a moment.
You don't know that's right. All you see is danger. Nothing to lose. In a world full of strangers, you don't know that's right. All you see is danger. Trying to find what you lost.
We are back again with Feels Out Loud, and this part of the show is where we talk through questions from you all, our beautiful listeners. If you have a question related to mental wellness, sharing feelings, or topics for each week that you'd like us to process through, please visit our website at becomingtogethermn.com and find the Feels Out Loud page to submit a question directly, or email us at contact@becomingtogethermn.com. Of course, follow us on social media as well. We really do want to hear from you and what you are wondering about.
Thank you, listeners who have sent in questions about accelerated resolution therapy. We had people who are very intrigued by this format. And what was really cool in my mind is several people who had tried it.
Yes.
And who had participated in it. So when you were talking in the last segment, Macy, about word getting out in Minnesota, I do think that's true because we had people who said a few different things about it. And that was why we picked the question we did. A person who knows about ART, but said, my therapist isn't trained in ART. I'm curious about it, though. So what would you suggest? And how would you respond to this listener?
Yeah. So if you have a therapist that's not trained in ART, you've got lots of options. You can ask them, especially if you have that trusted relationship with them, ask them, what do you know about it? And if they say, I don't know anything, well, then you skip the next question. But if they say, I've been hearing things about it. Hey, what would you think about me seeing another therapist for ART? And what's cool is you can do adjunct work where they can go do that ART work with a different therapist and keep the current therapist. Because my thought is like, if you don't want to switch, this is the next best thing versus just not ever trying it all together. If you're okay with switching altogether, great. But that ART therapist is going to be like, you can go back to your regular therapist. Like you don't, so it's different in that way. Like it can be adjunct. You can find, and it is so short term that it doesn't have to be a big deal at all. We just make sure, like, for example, if somebody comes to me, they already have a different therapist who they're doing talk therapy with. They come to me for ART. I'm just going to be collaborating with that therapist to ensure care coordination. And then I'm going to be making sure that our goals are delineated properly. That way, it doesn't waste the client's time of maybe repeating a bunch of goals and things.
Yeah, the idea you can have both. You can have all the things. And it doesn't have to get integrated on the long haul or over the course of time. So I want you to have time to tell us about Emerald Therapy, your practice, who works there.
Thank you. Yes. So we have when I first built a group practice, there was always that question of, do you hire people who have the same specialties as you or different? And I ultimately, with your guidance, Becky, I decided different. I wanted to have different specialties. And so at our practice, we have a little bit of every all sorts of specialties. We have therapists that have all different walks of life and backgrounds and personal experiences that inform their work. I will say, yes, most of us do ART, but that's just, that's because we talk about it so much and we're so passionate. But a lot of us have our own little specialties, like mine and Danielle's would be perinatal. Molly is really great with grief and loss. Kelly has historically been really good working with other therapists. So it just, everybody's kind of got their own things. That way, when somebody reaches out to us for looking for something, there could potentially be a fit there somewhere,
Well, one of the reasons that we're fans of you is you're one of those get it human beings who just does a beautiful job at meeting people where they're at and understanding their life experiences. So listeners, look up Emerald Therapy and the providers that are there. And we are already at the end of our show for today.
Oh my goodness.
Thank you for
coming.
listening this morning. Thank you for being here. Join us next week, everyone, as we process more mental health focused topics. And in the week ahead, be kind to yourself. Remember, connection fosters wellness, and your voice is one that the world around you needs to hear. Share yourselves, friends.
We get back up and try again. Some do, some don't.